Canadians, our healthcare system certainly isn't about healing you. In fact, it more and more seems like a cash cow for Big Pharma and their government cronies. Canada's universal publicly funded healthcare system, known as Medicare, was once a cornerstone of national pride and even a model admired by others like the United States, who doesn't have universal access or coverage. It's often held up in political debates as the gold standard for equity in care. But today, most Canadians have firsthand experience with our so-called world-class healthcare system, and sadly, it's anything but reassuring. From being turned away at clinics, unable to find family doctors, left in waiting rooms and hallways for hours on end, or waiting years for surgeries while drug companies rake in billions. As much as those on the front lines try, this isn't healthcare, it's a rigged game, lining pockets instead of curing people. And according to the latest stats, this is dragging Canada down to near third world standards. While Canada spent $43.5 billion on pharmaceutical drugs in 2023, a massive jump of nearly 14% since 2022, it also spends the fourth most on healthcare as a share of GDP globally, yet we ranked second last on the Consumer Choice Center's Healthcare Time Saved Index. Only Ireland is worse. This index is built on OECD data, wait times, and patient experiences, and ranks 20 advanced systems. The top-ranked countries are Denmark, Switzerland, and the Netherlands. Why? Because they prioritize efficiency and private sector involvement, which inevitably minimizes wait times, ultimately helping preserve low-income individuals' access to quality care. Meanwhile, Canada ranks a measly 20. Because our system isn't designed to heal, it's built to keep you sick, dependent, and profitable for Big Pharma. Think about this. Now, according to the Financial Post, Canadians wait an average of 68 minutes for in-clinic appointments, the worst in the rankings. We're also worst for average wait times for surgeries with a median of 210 days waited. Canada ranks third worst for time wasted on regular checkups. When efficiency is the metric, waiting 210 days for elective surgery and spending over 200 minutes a year just to access basic checkups isn't only inconvenient, it's damning. These delays don't just cost time, they cost health. Conditions worsen, interventions come too late, and the burden on an already strained system grows heavier by the day. And yet, while you're suffering, Big Pharma's pushing pills, not cures. The longer you wait, the sicker you get and the more drugs they can sell. It's no accident that Canadian hospitals rank low in the OECD stats for doctors, beds, and equipment. Less care means more prescriptions. And that's where the real money is, straight into the pockets of drug giants. Don't buy the lie that this is about public good. With the longest elective surgery wait times and severe primary care delays averaging 14 days, Canadians are fed up. 73% of us want major reform and 69% are open to a mixed public-private option. As I said, look at Switzerland and the Netherlands, which rank at the top of the index. Again, they have private care, competition, and systems that prioritize patients over profits. Their system incentivizes care. Ours seems to incentivize drug sales. Meanwhile, Canada's government-run monopoly funnels your tax dollars to Big Pharma's bottom line. Quebec's private clinics are clearing backlogs, but the feds won't budge. And Ontario is posturing itself as a pharmaceutical hub, with $1.3 billion invested since 2023 by AstraZeneca alone. Since 2018, Ontario has attracted over $6 billion in investments from pharma and biomanufacturers. This is a business, and you're the product. But overall, it's also a betrayal. Our healthcare system is a third world embarrassment, not because we lack money, but because it's a machine to enrich Big Pharma while you rot in the waiting room. Or your baby dies because an ambulance can't get to them in time. Canadians deserve better. Private options, real competition, and a system that heals, not exploits. It's high time that we end this corrupt cycle and demand a healthcare system that puts you first, not drug company profits. For Rebel News, I'm Tamara Ugolini. As a pharma hub, Ontario is also one of the only provinces harshly excluding students from their publicly funded education when they don't submit their vaccination records to public health. If you'd like to learn more about this topic and get involved and perhaps even support our work, please do so at stopvaccinecoercion.com. That's stopvaccinecoercion.com.